My name is Kathy Shumans. I am the assistant nurse manager on 5 St. Simons, and I have been here for 35 years. The hospital has truly grown over the years. I remember when Parkwood was the main entrance, and it used to have a half-circle drive back when it was called GBMH for Glen Brunswick Memorial Hospital. But just the expansion and everything, it's grown with the community. As the community's grown, it's grown. When I first started, before I was actually hired, I was a volunteer. And so I've actually been here longer than 35 years, so those 3 extra 4 years don't count, but that's where I got my basis, being a volunteer. And then I started working in SPD when I was in high school, so I've been here longer than I've been out of high school. And then I went to nursing school, was an LPN for 4 years, and then became an RN. And for the majority of my nursing career, I have worked nights, but for the past 3 years now, I've been on days. I do like the daytime because you get to see a lot more people and you get to interact with more departments and everything. You get to see where your patient's going. You know, at night they're just going to bed, and in the daytime you can see them going to dialysis and surgery and coming back, and you really get to see their progression more. Since I've been out here so long, you know, and literally grew up out here, a lot of people have become like family to me. And I mean, these bonds I can never replace. I remember Charlie, back when I was in SPD, I would be cleaning his nurse servers, you know, when SICU was down on the first floor in the corner back here. And I have so many memories of so many people, you know, and people that I've taken care of in the community. I'm proud of having done a little bit of everything that's kept me out here throughout all the years. You know, it's the summation of me being a volunteer, working on the baby floor, me being in SPD that taught me how to put people in traction, which led me to working on the orthopedic floor as a nurse, you know. So it's the summation of having done a little bit of everything, you know, that's made me who I am today. I lost my mom and dad when I was younger, well, in my 20s. And, you know, so therefore, the floor that I was on, 5 West at the time, you know, they were really close to me and everything. And I just hope that I've done my mom and dad proud.
My name's Carrie Philippar. I am nurse manager of 5 St. Simons, and I've been with the health system for about 6 years. When I first met Kathy, I came in as a staff nurse, and we were peers. I was working day shift, she was working night shift, and we just worked really well together. Then she took on an assistant nurse manager role, so she was somebody who I reported to directly. Then I moved to the education department, where we worked together in that regard, where I helped with education on 5 St. Simons. Then I had the opportunity to become the nurse manager of 5 St. Simons. So now we work in a relationship really well together. Kathy is one of the sweetest individuals you'll ever meet. She is the person who remembers everyone's birthday, everyone's anniversary, their favorite color, their favorite candy. She knows about their kids and what activities they're involved in. She will learn everything that she can about you, and she remembers it all. She's the party planner, the cake baker, she's the one who makes sure that everyone has something if they need it. She's a caring, supportive nurse. She is someone who has great skill, also has great compassion, and she's everyone's favorite IV starter. So they all go to her when she needs an IV started because she is the master. There's not too many people who really are super genuine the way that she is, so I applaud her for being that way.